So here we are. So my name is Bill Johnson. I'm a physician at Exeter Hospital and Core Physicians. I'm a urologist, and this is Frank.
I'm Frank Firmino, and I am a patient with Core Physicians and a patient and successful cancer survivor of Dr. Johnson's.
So we wanted to talk a little bit today about prostate cancer and prostate cancer screening, but in general also kind of a patient's perspective and their journey through the process. And Frank was going to describe a little bit about how I got started and how he went through it, and then now on the other side.
Well, I guess basically it starts with, like with anybody else, it was a regular doctor's appointment, and my doctor was good enough to be able to say, hey, you've had some family history, we should probably keep an eye on this and do some extra testing. And we took a look at a lot of the different numbers that are there, PSA, things like that. And it wasn't high, but it was elevated for someone of my age. And so from there, then we did some other tests. Look at an MRI, see what that shows. Go forth with a couple other things to see what that shows. And unfortunately, you heard the words that, or I heard the words that no one really wants to hear. But because I was early and early detection, we had choices of what we wanted to be able to do. And ended up going with surgery, which Dr. Johnson was able to perform with him and his team. And it was a kind of a struggle recovery. It's not easy, I'm not going to say it was, but it was easier because of the information that was given to me. And just trying to stay in shape, doing things before even that, riding bikes and just trying to eat healthy and things like that, I think made it a little bit easier for me to get through. And having a great network of friends and family to support. And here I am a year later since the surgery, and I've done some epic bike rides, just gone out and done a bunch of things and spent a lot of time with family. And a couple of checkbox rides that I always wanted to do. Went another place in the country and did 104 miles in gravel. And that was hard. It was a lot of fun. And so here I am now. So just telling other people, you know, keep an eye on these things. And you can be on a bike a year later.
With your doctor.
With your doctor, yes.
Everybody should get screened for prostate cancer if you're a man between 55 and 70. And it's very important. It's simply a blood test, and you can talk to your doctor about the pros and cons of moving forward with that every year versus every couple of years. But prostate cancer is real, and it's very treatable. So I would encourage everybody to take that seriously and maintain a great relationship with your doctor in the office and on the trail.
Speaking of that, let's go get some gravel miles in, huh?
Let's do it.
All right.